righty everyone, welcome to this Look and Feel Better Q&A session, and I cannot believe we are saying for December, so welcome to the 1st of December, and it's great to see you all joining from around the country. So just before we get started, I will just say that our guest speaker won't be providing medical advice or answering questions specific to any individual medical situations, but so we encourage anybody to speak with your doctor or oncology team regarding any personal health and treatment plans that you may have. However, it's not me that you want to hear from today. So I'd like to introduce our December session, which is Looking Ahead with Confidence, Living Well with Palliative and Hospice Care. And online we have the wonderful Susan Fryer. Now, this very special Q&A offers you a chance to explore your thoughts in a safe, supportive space. Susan, who's a nurse practitioner from Tōtara Hospice, brings years of experience walking alongside people through this stage of their life. Susan comes to us with warmth and honesty, and she's going to talk about how palliative care can support you alongside treatment, the emotional and practical help that's available to you and your whānau, and how to make choices that reflect what matters you most. So this session is here to offer some clarity, comfort and connection. And it's my absolute pleasure to welcome Susan. Over to you.
Kia ora, everyone. Thank you very much for having me on your Q&A session today. I really appreciate it. I'm a nurse of 31 years, and most of those, so at least 25 years, I've worked in palliative care. And a lot of people say when they hear that I work in palliative care, gosh, that must be a hard job. But it is one of the most rewarding roles that I have ever had, and I absolutely love what I do at Tōtara Hospice. So today I'll just share with you my presentation. So as I said, I'm a nurse practitioner from Tōtara Hospice, and I would like to just add a disclaimer that the experience that I share this evening does come from Tōtara Hospice, and just acknowledging that this evening you will be living in different regions of New Zealand. So your services might be a little bit different, but I'm very happy if you want to put some questions in the chat box to see if I can clarify some questions at the end. Okay. So what we're going to do today is just a little overview of what palliative care is, and really want to acknowledge the audience this evening that for some people, they may have already been involved with a palliative care team, or it might be something very new today. As I said, I'm going to try and go through this just piece by piece, and if you've got any questions, if there's anything that you feel that you just want a little bit more clarification throughout, again, just ask me, okay? So we're going to talk about what palliative care is. We'll look at the role of hospice and explain really what the difference is. I'm going to try and dispel some of those myths and misconceptions that people in the community, as well as other healthcare professionals, have about what we do at hospice. Also want to have a look at really thinking about what is important to the person that has got who's living with a life-limiting illness, and how we can support you to ensure that we know what is important throughout your illness journey. And also we'll touch base on another important aspect of your care, and that is the people that are surrounding you, that your support. So we're looking at some resources that support the supporters as well. And again, some questions at the end, very happy. So what I just want to start off with is the World Health Organization definition. And that actually defines the work that we do. And while it is nearly 30 years old, it is still really relevant. So I've highlighted some of the key aspects. In palliative care, the main focus really is about improving the quality of life of patients as well as their families and whānau. And from a New Zealand perspective, again, that is something that we hold very dear in palliative care circles, is that the patient and the whānau are one. We're highlighting again that this is support for people that have got life-threatening illness. Now, historically, palliative care was defined as supporting primarily people that had a cancer diagnosis, but today it encompasses care for individuals that are living with a wide range of serious life-limiting illnesses, such as heart disease, motor neuron disease, and dementia. This is a very long definition, but so we're just focusing on the key elements here. And in effect, palliative care, it is provided by a network of different healthcare professionals in the community, as well as in the hospital. And we are dedicated to helping people live well, and in order to be able to improve their quality of life. So making sense of the care team. Where does palliative care fit in? Now, I just want to acknowledge that there is multiple team healthcare professionals involved in somebody's care, and that might be people that are coming into the home, different visitors like district nurses, and it might be appointments to outpatients. You might be having treatment as well as GP appointments. So there's a number of different people that might be involved in your care. And what we want to do today is sort of look at where does hospice and palliative care fit in to the wider care team, and how we can influence good care and quality of care for yourselves. Okay. So palliative care is a concept. It's something that we do, and it's seen as a broad term for the holistic care of somebody. And it is a concept, is an approach to care that is appropriate at any age and stage of someone with a serious illness. And that can be provided alongside curative treatment. And I think that's something that we really need to really think about, that it is not something that is seen as at the end of life. It is absolutely, palliative care walks alongside those doctors and teams that are working with you in the hospital. So the word palliative care comes from the Latin term pallum, or to cloak or to cover. And so when I'm visiting somebody at home for the first time, the way that I describe who we are and what we do is that I describe that we are a service, a team that provides care that covers a number of different aspects of life. So it's not just looking at the physical aspects. It could be looking at your spiritual, your emotional, your cultural. Very similar to the Te Whara Tapawha, the Maori health model, where in order to remain strong, you need to have 4 pillars of the walls that need to be supported. And in the same way, from a health perspective, if we are feeling really sick from a physical symptom, then that can have a knock-on effect on how you are feeling, your emotional well-being. So it is a support that we can provide for the whole person. And we focus on quality of life. Now, if we think back to the World Health Organization definition, it does talk about working alongside people having treatment. So we are looking at what is important to you, and so we can help support that. And quality of life can be different for different people. For some, it might be about controlling their physical pain or breathlessness. It could be supporting, the emotional toll of living with a life-limiting illness, or perhaps when you are supporting somebody with a life-limiting illness. It is a multidisciplinary, and when I say that, under palliative care, we have a broad team of doctors, nurses, social workers, counsellors, bereavement team. We have the physiotherapists and the occupational therapists, as well as cultural liaison support for patients from our hospice. It's also important to remember that the term palliative care, though we use very regularly in our work, for a number of the communities that we serve, the word palliative care doesn't actually mean anything. It's not very translatable. So we have to think about other ways of being able to explain what support we can provide. So who provides palliative care? Well, in actual fact, palliative care is provided by our usual healthcare professionals. So our GPs, our hospital doctors, and our oncology teams, for example. And it is part of the care that you already receive. And in this aspect, these teams can focus on helping to coordinate your care and help to keep your symptoms under control. Now, these teams have access to, for support, and can refer to specialist palliative care teams for advice. So if we think that if you have ongoing hip pain, your GP will very likely refer you to either an orthopedic surgeon or a musculoskeletal doctor. In the same vein that if you are living with a life-limiting illness and you have nausea, that despite the treatment plan that is in place, you still have got nausea, then it's the similar idea that your GP will refer you to the palliative care team for that specialist advice. So what is specialist palliative care? So when I introduce myself, I say that I'm a nurse, my specialty is palliative care, and I work at a hospice. Now, specialist palliative care teams not only work in a hospice, in a building, in an inpatient unit, they can support people at home, but also you may well have come across and been introduced, if you have been in hospital, to a hospital palliative care team. So again, the focus is the same. Referral to a specialist palliative care team will be dependent on your need. So not necessarily a referral will be made if you have a life-limiting illness. If you are managing your symptoms and all 4 pillars of your house are intact, then it's not necessary for a referral to be made to a hospice. We might be involved at specific touch points. Now, if you are in a hospital, you might be referred to a hospital palliative care team and they might follow you up for a few days. If you are at home, then you might get a referral to a hospice and the hospice team will support you at home. And then again, that period of involvement might be short weeks or it might be a few months. It really does depend on what your needs are. And again, just emphasising that having a palliative care referral or involvement from the palliative care team is still appropriate during treatment that's aimed at improving quality of life. So if we are caring for somebody in the inpatient unit at Tōtara, often we will have people that will be coming in for a few days and will have an appointment with their oncologist. They may have that on a Zoom call, or they might have a chemotherapy appointment, so they will go to the hospital for that treatment and then return to the hospice. So again, it really is about working in tandem with the oncologist, for example. Okay. One of the benefits of being referred to a specialist palliative care team is that we are a team that can help navigate those new phases of an illness. And when things are starting to change, then we can, as a multidisciplinary team, help to support you navigate that journey. Now, one of our consultants, Dr. James, he will often say to patients, "You are the captain of your own ship. We are here as your support crew. So we're not going to tell you what to do. We're not going to tell you what's important. We are here to help guide you to be able to ensure that what is important to you that you can achieve." And I really like that analogy, that it is absolutely that you are in charge of your illness journey and we are here to support you in whatever way that you need. So what I thought I would show here is that, hospice, it is more than a building. I've just picked a couple of hospices from around the country. So we've got in South Auckland, we've got Tōtara Hospice in the middle. And just underneath Tōtara Hospice, we've got Mary Potter, who's based down in Wellington. And then to the left of Mary Potter, I think, is Nelson Hospice. And what you'll see there is that those three are physical buildings, and each of those hospices have got an inpatient unit. We've also got Franklin Hospice, and to the opposite direction is Waiheke. Now, both of those services provide a hospice palliative care service, but they are specifically for home care. So they don't have an inpatient unit. So that's a bit different. And also I added in a photo of a hospice shop, because it isn't uncommon for some people to assume that hospice is just an op shop and that it doesn't actually have a palliative care service behind it. And again, that is up to us as palliative care communities to really promote what the hospice is about. So here, I just wanted to be able to dispel some of the myths that patients and families might have. And I'm also going to say that some healthcare professionals also have some ideas about what hospice provides and what it does and what it doesn't do. And when I worked as the hospice manager in the inpatient unit at Tōtara, we'd often get students, either medical students, nursing students, or visiting medical professionals to the hospice, and it would be the first time they'd ever come into the hospice. And I used to think that if by the end of the day we have been able to dispel some of these myths that I'm sharing with you today, then I think that we've done a good job. So I think the first big one that I wanted to bring up was that, there is a myth that when somebody is referred to hospice, then it means that their doctor is giving up on them and that there isn't anything else left that they can be offered. And really, as healthcare professionals, we are working really hard to raise the profile of different teams working together and working alongside each other. And as I've already previously said, when we have patients in the unit, they will still go to their appointments and have their treatment. So it is definitely now a service that works alongside active treatment. So some people think that hospice is an aged care facility as well, and it certainly isn't. Now, we cater for people here at Tōtara from the age of 17 years and upwards. And unfortunately, it's not uncommon for us also to care for people that are in their 20s, 30s, and 40s. And so a majority of our referrals that come into our hospice are actually for patients that are in the age group of 45 and 64. And so that's not necessarily care of an older person. So it is definitely a hospice for all of our community. I also wanted to share that when somebody is referred to hospice, some people might think that that means that they have to have all of their care in our inpatient unit. In South Auckland, most of the care that is provided by people that are referred to hospice is at home. So only a very small amount of people will come into the hospice. Oh, I've gone back. There we are. And another myth is that when you come into hospice, you can live here until you die. But it's actually not a long-term placement. I would say that most of the inpatient units that are attached to hospices in New Zealand are between 8 and 12 beds for a very large community. So we haven't got the facilities to be able to care for somebody long term. As I said earlier, it's very much about a short, intense period to support somebody before referring back to the GP. Often some people will think that hospice is only, somebody is referred to hospice when they are imminently dying. And to address the elephant in the room, it is somewhere that we can support people who are dying, but it is not the only reason that people are referred to hospice. Most people that are referred to a palliative care service, whether that's in the hospital or in the home, like hospice, a community hospice, will be to support people with uncontrolled symptoms. And symptoms that are quite common for people that have got a life-threatening illness, such as pain, nausea, vomiting, constipation, breathlessness. And so physical symptoms are one reason why people will be admitted into a hospice or referred to the hospice to be cared for at home. Also, people will be referred for palliative rehab. So some rehabilitation, and that is also a really important part of the care that we provide. So having the occupational therapist to support with equipment, as well as the physiotherapists to be able to support with mobility as well. That is one of the key aspects of the care that we provide here at Tōtara Hospice. Okay. Sometimes people are reluctant to accept hospice care because they think they have to pay for it. When in actual fact, hospice, there is no cost to the person who requires care. Now, we are a non-government organisation, so most hospices will get around 50% of their funding through government, and then the remaining 50% will be raised through fundraising. But at the moment, there is no cost to patients. So, by being able to dispel that myth, what we hope is that people will accept our service sooner rather than later. And in South Auckland, we have a very ethnically diverse community, and this is absolutely mirrored with the referrals, with the people that we are caring for in our service. And what we want to say here is that it is for everyone. It is not for one particular group in our community. It is for everyone. So we're moving on now to talk about what matters to people with a life-threatening illness. I'm quoting an Australian study here, and also I've included the link to a conversation starter. And this is a really user-friendly and helpful resource for people to help navigate these sometimes difficult conversations. And the study that was done in Australia did show that a lot of people do want to talk about what is important to them. Where do I want to be looked after? Who do I want looking after me? However, only 25% have actually talked to their family and their loved ones about what's important to them, what their preference is. And even less have spoken to their healthcare professional about what is important. And then that really sort of demonstrates that there are missed opportunities for healthcare professionals to bring up, to initiate the conversation to what is important to you. And we do know that as healthcare professionals, those that aren't used to having conversations around end of life, that can be quite awkward for some people. So what we want to share really is that if you do have questions, or if you do have preferences about how you want to be cared for, I want to encourage you to bring that conversation up with your healthcare professional, whether it's the district nurse that is visiting, if it's an opportunity when you are going to your next oncology appointment. Take that step and start the conversation. What I want to show you next is some information about advanced care plans. Now, this is sometimes a very difficult but so important conversation to have. And it helps because this is something that families will be able to support you with. And by having these conversations, it helps families to come on board as well. And I'm wondering if anyone in the audience this evening has considered having an advanced care plan or has completed one themselves. So the focus here is the opportunity to express and to document your future healthcare wishes and priorities. And so communicating your preferences with your family and the team at the health centre or with your specialist. And important to know that this isn't a one-off conversation. This is a conversation that can evolve over time. What is recommended is that having these conversations, have them when you are well. I remember sharing an advanced care plan with my father many years ago, and I said, this is an opportunity for you to tell us what is important to you. And his response was, I don't need this. Your mother will know what to do. And actually, that wasn't very helpful when the time came. So I'm sharing that because sometimes people assume that their family or their loved one will know what is important to you. When in actual fact, when in a stressful situation or in stressful times, it's really difficult to work out any of that. So having that conversation earlier rather than later when you are well takes a lot of the pressure off having those conversations when it really does matter. Okay. So we're moving on to supporting the supporters, so families and loved ones. And in specialist palliative care, whether it's provided in a hospital or in a hospice or at home, it includes the support of families, and families are integral to the care that you receive. So our team at Tōtara Hospice, we work alongside families all the time. And we can provide those practical skills, knowledge, and give families that ways that they can conserve their energy, because it is really important that we look after the carer as well as the person that has the illness. And most hospices will have that wraparound service. As I said, social workers, family counsellors to support you, physiotherapists, cultural support, doctors and nurses. So it's really about knowing how to support you, to have the ability to continue to provide that support long term. Now here, I just wanted to be able to share that, some family perspective. What is it like to care for somebody that has a life-limiting illness? And what families have said is that it is really important to be prepared for the changes that are going to happen in the family home. Roles, how dynamics can change. And you may well have already experienced those changes, and it's about readjusting the family norm to be able to continue to support. We know that families become very resourceful. They pool their support around each other and acknowledging that you're in it together. And, what we also find is that family members become their loved one's biggest advocate. They learn new skills and they become expert in the illness. And they become very good at solving problems and thinking around the solution, looking at new ways of solving things. The other aspect that's really important for families is that knowing what services to call and when. And what that helps is it connects the dots. And that's really important when there is a change in their loved one's health. So just knowing what support is available is really important. And also just acknowledging that caring for somebody with a life-limiting illness and end-of-life care, it's a very highly personal experience, and it can be very different for everyone. So it is unique. So you might not feel it. However, only about 7% of the care that people receive is given by medical or healthcare professionals. So that's a really small percentage of care compared to the wider aspect. And so really, it's important that you as a carer, that you have a community or a compassionate community around you to help you. While we know not every loved one or caregiver has a large family or whānau around them, it is important that you know who to support, who to be able to access support, and hospice can help you navigate that system as well. I wanted to share some resources that are available for caregivers. I'm wondering if anybody is familiar with any of these resources that we've got here. Kite Aronui, which is palliative care resources for whānau. We have the Time Out charity. Now, this is a really good charity that offers holiday accommodation to people with a life-limiting illness. So I'm very happy to be able to share some more information about Time Out. if you Google health resources for families and palliative care, you can just imagine the amount of resources. But I wanted to focus on resources that are specific to New Zealand here. The Healthify website is very good. We've also got some really good resources here on Hospice New Zealand, resources for caregivers. And I love checklists. And there are a number of downloadable checklists for different aspects of care. So I would really highly recommend the Hospice New Zealand website. We also have end-of-life care doulas. They are a separate service that is available. It's a private service, and it's a service that supports people throughout their life journey. And again, a very good service if it's available in your community. I also want to share with you just, it was a very last minute recommendation, but I'm going to share a podcast and a book by the same authors. There is a book called Hope for the Best and Plan for the Rest that is available for people that have living with a life-limiting illness and their caregivers. And also a podcast called The Waiting Room Revolution. And again, it helps people to navigate conversations and anticipate the ripple effect of different aspects of care. So again, that's a recommendation that was given to me at 4 p.m. today. So just wanted to add that in this evening. So as caregivers, it's really important to be looking after yourselves. And for caregivers, they are equally as impacted by illness as the person that has the life-limiting illness. And so as caregivers, it's really important to try and develop a really good self-care plan. And that is essential for you to be able to continue to do the important role that you are doing with your loved one. So knowing your limits, there's only so many things that you can do yourself. And so it's really important to be asking for help and recognizing what your limits are, and it's wisdom. It's wisdom knowing how far you can, what you can do. And so being able to ask, it's not seen as a weakness, it's seen as a way of being able to sustain yourself. So tapping into hospice and community support. Now your GP can refer people for a needs assessment if people are eligible for some support at home, whether that's for personal cares or it might be for meal prep or support at home. So there are outside organisations that are free that can be available. So again, it's about connecting the dots, knowing who to talk to help guide you through this for additional support. In this day and age, staying connected, maybe not face to face, but online, has become a lot easier. And I have friends who are connected to other support groups solely online. And that is the way of the future. I'd say that, for a lot of people, they can't actually get out of the house and, have a face-to-face connection with support. But sometimes it can be available through the screen like we're doing this evening. Some hospices do still offer respite support. So again, get in touch with your GP or your local hospice if you are already involved with them, to ask if respite is available. Okay. And again, it's really important that throughout this journey for yourselves as caregivers, that you have that opportunity to be mindful of your own spiritual well-being as well. Oh. So just want to say thank you very much for being online this evening, and I'm very happy to answer any questions.
Susan, that's been absolutely wonderful. Thank you for your lovely presentation and your wonderful way of presenting as well. You were so lovely and easy to listen to. And
As soon as I got the slides up, that
this is
sorry
technology
about
for
that,
us,
team.
isn't it? And look, I know the dealings I've had with hospice in Taranaki and the wonderful services as well as the day programs that they offer is fantastic. So now, ladies and gents, this is an opportunity for us to share some questions around. If anybody would like to ask any questions, we've got some time left in our wee schedule here. If anybody wants to put something in the chat, or if you don't want to write in the little chat box, please unmute yourself and feel free to come join us and share a question with us. All right, here we go. Thank you. So I would like to know if the hospice care can be done completely at home. That's a really good question.
Great question, Kat, and the answer is absolutely yes. So there is no, so hospice care can be provided solely at home. Okay, and as I mentioned earlier, the inpatient unit really is for a short period, and it's not everybody requires that inpatient unit care. So absolutely, most of the patients that are known to Tōtara Hospice are cared for at home all the way through.
Lovely, thanks, Susan.
I hope that answers your question.
We also have another question here. So what is the best way to approach palliative care with an elderly person?
Okay. So that's a good question. So again, it does depend on what the needs are. Okay, so being in an advanced age doesn't necessarily make you eligible for hospice support. So there has to be a specific need. I think if we're talking about in an aged care facility in a private hospital, for example, if the staff that are caring for somebody in a resident in an aged care facility, and they identify that there might be some palliative care needs, then they can also refer to the hospice to be able to come in and support, but also provide the nurses in the private hospital that support as well. Okay. If I haven't answered your question, very happy if you want to ask me again in a different way. I wasn't sure if I'd answered your question.
Susan, we've had another question come through online. So the question is, I'd welcome tips on managing well-being during progression and changes to meds when living with stage 4 cancer. Are you able to answer that one?
Yes, I think so. So medication, while it is there to provide relief from ongoing suffering, we know that medication also has side effects. So sometimes we have to balance the side effects of medication with more medication, unfortunately. And that can be quite tricky to manage. I think if we can often get that balance right, so that when you are living with stage 4 cancer, people can still live well. It's about working alongside the healthcare team. If there are tweaks to medication that are needed to be able to just get you, what's the word I'm trying to think? Sometimes we just need to tweak either dosage or maybe change the type of medication that is being given to be able to get you back on the right path. So the key message here is that if you feel that your symptoms aren't 100% managed or under control, go back to your healthcare provider, whether that's your GP or your oncologist or the hospice nurse that might be visiting you, to say, at the moment, the medication is giving me 80% control, but I'm still feeling yuck, 20%. What else can you do to tweak? I hope that answers your question.
I think, that sounds very good. Thanks, Susan.
Okay.
Now we've also had from saying she really loved your myth section, and many of her questions have been answered. So was hoping that we'll be able to share the slides. So we'll look to be able to do that and email those out to you. Now, everyone, I'd just like to add that Look Good Feel Better has a podcast episode on our YouTube channel with an end of life session. So we'll get that popped into the chat for you to be able to, for everyone to be able to access as well. I can't, sorry.
I would just like to say that I'm really pleased that I've been able to dispel some of those myths for people, because for a lot of people that actually stops them even accepting a referral to the hospice. And part of my role is to be able to promote the work that we can do to keep people living well with really good quality of life. So I appreciate that feedback. Thank you.
Now, everyone, I think that's one of our last Q&A sessions for Look Good Feel Better for, crikey, what are we, 2025, and we will resume early in the new year. So we look forward to being able to see you on our next session. So please go on our website. There's tons and tons of podcasts on there, and we'll have the list of all of our up and coming speakers for 2026 coming up soon. So thank you all very much for coming. We appreciate your support, and I hope you've enjoyed or gotten lots out of our session today. So we look forward to seeing you again. And I guess we can say it's December. We can almost say, have a very Merry Christmas. Ka kite, everybody.
Ka kite. Bye-bye.